Welcome back to TV5 News at 9. Everyone, it is time now for Medical Moments with Covenant Healthcare. And joining us this morning, we have Nurse Ann Worley from the Covenant Cancer Care Center. And thank you so much for being here. How are you today?
I'm fine. Thanks for having me.
Yes, we would love to have you. So today we are talking about preventative health screenings. Very important. So Ann, your team's job is to educate people on the importance of these screenings. Why are cancer screenings so important?
Well, first of all, I'd like to say Happy Breast Cancer Awareness Month to all of our survivors out there, men and women. You've done a great job and you're an inspiration.
Yes.
And that's why we would like to highlight our screenings for you. We believe that screenings really are the path to more survivors. At Covenant Healthcare, we offer screenings for many types of cancers, breast cancer being one of them. Mm-hmm. And today I'd like to just talk about some of the parameters we use for people to screen. In mammography, we like to start at age 40, and the patient should continue to screen as long as they are in good health. That means if you maintain your own household, you drive yourself, you get your own groceries, and you maybe are 75, you should still be screened.
Okay.
In addition, patients who are at high risk, maybe they have a mother or a grandmother who was diagnosed very early, before age 40, should have a conversation with their physician about when is the best time to start being screened for breast cancer.
Thank you for that information, Ann, and definitely important too. You want to get those screenings, and there are some specific ones that you want to focus on for 3 types of cancers prevalent in our community. Can you tell us about each of these, who the screenings are for, and then the type of screenings available?
Sure. As I said before, the first one was the mammography for breast cancer screening, and we would like people to know that if you can't afford a mammogram, we can help you through our partners at the BCCCP program of Michigan. Mm-hmm. The second type of screening I would like to talk about is our colon cancer screening. Colon cancer has come to the forefront because celebrities have been diagnosed at younger ages. They've decreased the screening age from starting at age 50 to starting at age 45. And if you're African American, in some cases starting at age 40, if you have a high risk profile. There are many types of screenings for colon cancer. The easiest, of course, is the fecal occult blood, which is very quick. You do it in your home and you send it back. However, those can be false positives and negatives. Okay. And if it is positive, you'd still have to have a colonoscopy. The colonoscopy is the gold standard, and it really helps us to see many places that other types of screening cannot. So that's the one we at Covenant recommend. And you should be having a colonoscopy starting at age 45, and then depending on what your doctor recommends, every 3 to 10 years, depending on what's found and what your risk is. If you do have colon cancer, they do recommend screening till 85, and after that, you're good. The third type of screening we'd like to touch on today is our lung cancer screening, low-dose CT. Mm-hmm. That's a specific population who is at high risk for lung cancer, and those are patients who are between the ages of 50 and 77 with a long-standing smoking history of what we call about 20 pack years. That's roughly a pack a day for 20 years of smoking, or 2 packs a day for 10 years. Those patients need to be screened. It's for current smokers or those who have quit within the last 15 years. They're at the highest risk for getting lung cancer. Mm-hmm. And so we really encourage you to have that conversation with your doctor and get in for a lung cancer screening. Lung cancer is the deadliest cancer, and there's screenings available. We need to take advantage of them. In addition, the one last thing I would like to touch on as far as prevention is smoking cessation. Smoking is not just a risk factor for our lung cancer patients.
Yeah.
Many cancers, bladder cancer, breast cancer, melanoma, skin cancers, they all are at risk if you are a smoker. So we really would like you to think about quitting. There are many resources available. The Michigan Cancer Quit Line, if you call 1-800-QUIT-NOW, there's local classes, and there's many types of things to help you quit. Gum, lozenges, nicotine patch.
Right.
So really, quitting smoking is a very, very good way to prevent types of cancer.
Very good. And I appreciate you detailing that out for us with those 3 cancers and those risk factors. Those are very important, so thank you. And if someone has questions about screenings, who do they contact and what they should do next?
If you have questions about screenings, you can call one of the nurse navigators here at Covenant Healthcare. My number is 989-583-5014. In addition, you can contact your family physician, who should have information for the screenings we do here at Covenant. You can contact the Covenant Breast Center or any of your local providers, and they can help you get set up for screening with us here at Covenant.
Very good. I would just like to add myself, my aunts got their screenings early and found breast cancer and was able to rid it. So it just goes to show the importance of getting screened regularly and early. And anything else that you would like to add for us this morning?
Just again, shout out to all you ladies and gentlemen who've beat breast cancer. Again, you're an inspiration. And I do need to say, my friend Kim, good luck this week. You've been doing great.
Yes, absolutely. Well, thank you for sharing that, Ann. It was great to talk to you this morning.
Bye now.
All right, see, yes, and I will also echo her message to our breast cancer survivors and patients. But if you would like any more information on today's topic, just make sure you head on over to the Hot Links page on our website, WNEM.com.